Today is a hopeful day for Ireland. It's the first time in 4 months that we're announcing that restrictions are being eased. And while there are going to be a few bumps in the road, I think that we are very much on our way out of this pandemic. This is in contrast to much of Europe, where they're experiencing a new wave and restrictions are being tightened. But we are taking a cautious approach. New cases each day are still very high. There's still more than 300 people in hospital, about 70 in ICU. And vaccinations, while increasing in number, the numbers actually vaccinated is still relatively low. So we are easing restrictions, as we indicated we would some weeks ago, for schools, for construction, the 5-kilometre limit and outdoor activity. But we're still asking people to stay apart, to minimise their social contacts. And from April 12th, our message will change from stay at home to stay local. So we're asking the Irish public to continue your actions to help slow and stop this virus. And while you do so, the government will increase its actions to fight this virus in 5 ways. We're going to accelerate the vaccine rollout. More people will be vaccinated in April than have been vaccinated in the 3 months to date. We now have PCR testing in walk-in centres in areas of high incidence. We'll be increasing the amount of antigen testing being done. My department will take the lead in relation to private sector workplaces, Minister Harris in relation to third level institutions, Minister Conalogue is already doing so in relation to meat plants. We're also bringing in enhanced contact tracing cases back 7 days where possible. And even though we have the strictest border biosecurity already in the European Union, we'll be making that stricter again in the coming weeks, starting with an additional PCR test on arrival as well as before people arrive. I know for a lot of businesses and for a lot of workers, there will be significant disappointment today. But when you reopen, when you go back to work, we want to make sure that you're going back for good. And therefore it makes sense to wait a little while longer so that we can get more people vaccinated and make sure that when we open, we do so in a sustainable way. So all things going to plan, and it is caveated on things going to plan, we will examine at the end of April, with a view to early May, the full reopening of construction, the phased reopening of non-essential retail, personal services and also religious services. And if that goes well, then we can consider hospitality in June. But this of course is all contingent on things going in the right direction in relation to the virus, hospitals, variants and vaccines in the coming weeks and months. In the meantime, the government's financial supports for businesses and workers will stay in place, whether it's low-cost loans, the pandemic unemployment payment, the employment wage subsidy scheme, the rates holiday, or the CRIS scheme. These will all remain in place at their current rates at least until the end of June. And as you know, we're continuing to add new sectoral schemes for businesses that don't benefit from some of these existing schemes all the time. And you'll be hearing more of that in the coming weeks. Thank you.
Thanks, Leo. And Minister Eamon Ryan.
Taoiseach, I'd like to start off by just saying a huge thank you to the health service in our country. It's interesting, we had a long series of meetings last night from about 6 to about 11, wasn't it? But the thing that struck with me is Paul Reid, the head of the HSE, kind of acknowledging how tough it's been, how they've been through the hardest quarter that the health service has ever been through. But they've got through it. They've done things we thought could never be done in terms of changing the vaccines rollout, and still changing now, to optimise it, to make it safe. They've looked after so many thousands of patients. We've lost patients, but we've also saved lives in the work that they have done. I'd like to say that the same about Ronan Glynn and his people, and the advice they've been giving us has been all time trusted, honest, clear. What they're saying last night is we're still at risk. We're not beyond risk here. We see across Europe a fourth wave, and we want to avoid that fourth wave. So it is slowly that we will lift restrictions you see here today. It's really good though, even to come in today. It's so tight, it's such a kind of sensitive time that the numbers today were lower than they were yesterday. Please God, that'll continue. And as the Taoiseach said earlier in his comments, the vaccination will help. So it's very slow, it's cautious, it's not huge opening up. But for our older people, there is now a sense of the path to recovery. That, over 70, if you've had your second jab, 2 weeks later, you can start meeting up with other people in the same circumstances. That isolation, that cocooning is starting to crack in a really good way. For young people, it's really important as well that we acknowledge their difficult situation in this and also what they have done. Figure jumped out for me from last night and all the evidence that they're presented is that our 18 to 24-year-olds, the actual positivity rate is staying really low. That's tough. Tough not having the social life you'd expect as a 21-year-old. But they've been doing it. They've been getting it right in how they keep social distancing. The numbers there are the most heartening thing I heard last night. Similarly, in our schools, in our primary schools, in our secondary schools especially, yet again, they've defied expectations with the positivity rate staying really low, wearing masks all day, just getting the basic things right. Our schools, our teachers and our students have done well. We need to start, and we are starting now, building houses for those young people as a message to them that their recovery for them is going to be key. And for all those underage teams, we'll be back out in the pitch again, because that healthy mind, mens sana and corpore sano, is so true. And part of that is them getting back involved in sport. We'll come back at the end of April with more details on this path, when they can get back to do a driving test or a driving lesson, when they can get their hair cut, or get back to a class in college where they meet up in person. That will come. We are on the path and the road to recovery. It will be a slow one, but as the Taoiseach said earlier now, it seems like a more certain one that we can see the light and see the way, and we will get there collectively together with our health service.
Thank you, Eamon. And I'd like to ask Dr. Ronan Glynn, Acting Chief Medical Officer.
Thanks, Taoiseach. Good evening. While the last few months in particular have been very difficult, we have more concrete reasons for hope now than at any time over the past year. Despite having to contend with a virus that is much more easily transmitted now than it was in 2020, we have succeeded in reducing infection levels from the peak experienced in January, once again proving that collectively we can work together to suppress this virus. We have also seen the successful resumption of in-school education and childcare services, and non-COVID healthcare services are restarting. We have 3 very safe and effective vaccines currently being administered in Ireland, and a 4th one, a 1-dose vaccine, coming very soon. We have already seen the incredible impact that these vaccines have had in reducing cases and mortality amongst people living in nursing homes. Through April and May, we will see levels of vaccination on a much higher scale to what we've seen to date. Our most vulnerable will be protected, and by July, 80% of adults will hopefully have received a first dose of a COVID-19 vaccine. This will change things fundamentally. We can and should be hopeful and optimistic of an enjoyable summer that's much better than what we've experienced over the past 6 months. But we're not there yet. The level of infection remains high and incidence rates have plateaued and may even be increasing. In the past week alone, we have reported almost 4,000 new cases, and our incidence is 63% higher than it was the week leading into Christmas. The numbers in our hospital are still close to the peak experienced in the second wave last October and November, and there continues to be a steady flow of admissions to hospital each day. Unfortunately, this means that we remain susceptible to a 4th wave of infection, particularly if measures are eased too quickly. But on the other hand, our modelling shows us that this risk can be very substantially reduced if we continue to keep this disease under control in April and May. I know this is a very hard ask after a particularly difficult 3 months, but we are asking the population to stick with us over the coming weeks. If we can do this, if we can protect the gains made over the past 3 months, we can protect our most vulnerable so that they can benefit from vaccination. We can get all our children back to school and keep them back in school, and we can expect to be in a much different and much more positive position this summer. I know that the measures being announced today are just the first step, but they are a first step towards a better future. Though modest, they will provide people with opportunities to do more and to socialise more outdoors. It is also hoped that the new advice for those that are fully vaccinated will provide some additional relief to those that have been in many ways the most impacted by the pandemic. We all want this initial phase of reopening to be successful, but for it to be so, we must continue to work together, acting together in the public interest. The measures that so many of us have bought into over the past year, keeping our contacts low, avoiding inter-household mixing, particularly over the coming Easter period, working from home, keeping our distance and wearing a mask. These are the measures that will see us through the coming weeks to brighter days and better times ahead. Thank you.
Thanks. So we'll take questions.
I'll take it if no one else will. I have a couple of questions. Just Taoiseach, first on a point of clarity, the vaccine bonus, when does that kick in?
2 weeks after you've had the second dose.
No, sorry, I mean, is in when is the policy effective? Is it from now or is it from,
yeah.
Oh, from now. From
Yeah.
now they can get it immediately. Okay. And then separately, could you outline to us the changes that were agreed at Cabinet in relation to the vaccine rollout programme and how that is going to work? And if it is as reported in that it will be one based on age that people will get their appointments, what do you have to say to the likes of teachers and Gardaí and family carers who were themselves hoping to be pushed up that particular list? And just in relation to inter-county travel, and maybe for yourself or Minister Ryan, some reports today that it might be until July that there would be inter-county travel. Is that correct, that we could be waiting that long?
Yeah, well, first of all, yes, the decision is to amalgamate the group cohorts 10 to 15 into one cohort. And so from that moment on, then everybody will be vaccinated on the basis of age, starting with the oldest age group, 65 to 69. Now, this is based on advice from NIAC, so actually it will simplify and accelerate the vaccination rollout, actually. So older teachers, more vulnerable teachers, any particular professional worker in terms of age will be vaccinated more quickly under this model. But critically, we have learned, even from cohort 4, that where you don't have clear databases identifying categories of workers, you run the risk of actually slowing down the vaccination program, particularly as higher volumes of vaccines come into the country. So the Health Service Executive has been looking at this from an operational point of view, and they feel this is a much more effective, faster model which will facilitate an accelerated rollout of the vaccines. And also, we know that the older you are, the more vulnerable you are to illness and mortality. So it's fairer in that respect on an age basis, and doesn't distinguish between one profession versus another. I think actually, when we gave the figure, if you think about this, vaccination program was going to ramp up April, May, and June. We're looking at 80% by the end of June, first dose. End of July, potentially 70% fully vaccinated. So the window is relatively short if you think about this, and the priority has to be efficient in the operational rollout of the vaccine, and to do so in accordance with the clinical advice we have received.
Just on the travel, I think we'll have to come back in the end of April with a much better idea that we've got over this very risk phase, and then we will set out month by month more detailed assessment. We have to be careful and focus on the data, not the dates, but to give clear signals around, yes, the opening up of the country. We expect people to be able to holiday in Ireland this summer, and I think that's important for people, for the country, and for the businesses. The huge numbers of people in the tourism industry who'll want to see that back. But that's not for today. The first steps of these important steps we're taking today. Further steps will be taken as the vaccine rollout gives us the breathing space to be able to do so.
Who's next? See you.
Yeah.
Christina.
How are you? Taoiseach, just wondering, some people might have expected on April 5th to have some sort of easing, and that's been pushed out somewhat. And we've heard a lot about holding firm and flattening the curve, phrases I think people are well used to hearing over the last year. So what are we trying to achieve by pushing out some of the easing for those 2 weeks? Are you hoping to see a fall off in the cases? As the Taoiseach said, perhaps this might be it. This might be the plateau that we are facing. Do you think we might see a fall in cases over the next number of weeks? And just some clarification also on the vaccination bonus. It's 2 households or 2 people? And could we perhaps explain what might be the difference between 5 people that are vaccinated meeting up, or 8 or 10? What's the difference between those cohorts of people? And just another issue on parents. They've been calling for particularly some changes to do with children's clothing and shoes over the last number of months. Obviously, it's been very difficult for them to get things online, to guess what size shoe their child might be. Was there any consideration given to what could be done there?
Yeah, well, first of all, I think the decision to go back to the 12th, to initiate some relaxations on the 12th, not the 5th, speaks to a safe and sort of sensible easing of restrictions, given where the disease levels are right now. And it is about being safe and sensible now in order to reap dividends later in the summer, rather than risk a further spiralling of the disease now, which could ruin the rest of the summer. So that is the context, and the advice from NEFID was very much in that vein. And what I'll ask is, I do take your point in relation to parents and the difficulties and challenges around particular items for children, and that I acknowledge. But again, we wanted to keep general mobility down as much as we possibly can. Another key factor on the 12th is, of course, all children will be returning on the 12th. The first year to fourth years at second level will be returning. We didn't want to do anything that would risk the return of children to our schools prior to that. In terms of retail, we will look at that towards the end of April, as we have said. It is difficult. It's very difficult for people, and on all sides. But we felt we have to try and keep mobility down as much as we possibly can, and try and get the balance in terms of suppressing the virus. I'll ask Ronan maybe to come in on the vaccine and the issues there that Christina has raised.
Sure, thanks, Taoiseach. I suppose as well, in relation to the 5th versus the 12th, we look back at Christmas time, and on the 18th of December we had a 14-day incidence of about 100 per 100,000. Today it's about 160 per 100,000. We had about 200 people in hospital the week before Christmas. Today we have over 300 people in hospital. So we need to get through the Easter period, and we need to be assured that people stick with the measures that they have stuck with so well over recent times. And we need to be sure that we can get all our children back to school. That has to be a fundamental priority for us, given what children have gone through over the past year. So that was some of the thought process that went into the recommendation around the 12th versus the 5th. In relation to the vaccine bonus, I appreciate that it's conservative, but we did flag that it was conservative. If there are multiple people across 2 households that are fully vaccinated, they can meet up, and the HPSE will publish more detailed guidance on this tomorrow. But we do want to proceed cautiously over the next few weeks with this, and then we look at it again. It is worth noting that we're one of very few countries that have taken this step to date, but we felt it was very important, given the disproportionate impact that older people in particular have had due to this pandemic over the past year, and the fact that we've asked them to cocoon and to basically cut off social contact over the past year. So we felt it was a very important signal to those people that once they're vaccinated, and importantly once they're fully protected, which is 2 weeks after the second dose, that they can begin to see others who are similarly protected. And hopefully it's a sign to the rest of society that vaccination really does represent something which will offer tangible benefits to us all over what is a relatively short time frame.
I think the best way to describe that one is in relation to the vaccine bonus is the rule of 2s. So it's 2 fully vaccinated people or 2 fully vaccinated households who've had 2 vaccines, and it's 2 weeks after they've had the second vaccine.
Taoiseach, you mentioned inter-county GAA training can return. Do you think it would be possible to have fans at All-Ireland matches this summer at all? And is there any advice on when clubs can return to training themselves? And then, Dr. Glynn, is there anything in today's announcement that goes against NEFIT's medical advice, or are you completely comfortable with the measures that were announced today?
First of all, in terms of, I'm not going to speculate beyond, in terms of fans attending, that would be very challenging. But I think what we will do at the end of April, we will look at all non-contact training for all ages. My understanding is the national associations of the respective sporting bodies have their own programmes. My understanding is that the Gaelic Athletic Association are looking at the inter-county situation first and the National League, to be followed by the Championship and then to be followed by the clubs. But that said, we will examine all non-contact training towards the end of April. I am conscious, and there are a whole range of groups and categories that Eamon spoke about that will have a very difficult April, and certainly in terms of underage training and non-contact training, at least we're bringing that forward to the 26th of April. But there's 18-year-olds up who will be playing with their respective clubs across the board in all codes. It's going to be a difficult April for those. I acknowledge that, but we just have to get the balance right, and it is about a safe and sensible approach that will reap better dividends later on, and that's the context.
So the decisions today are very broadly in line with the NEFIT recommendations. We had not made any recommendation in relation to the construction sector. My understanding is that's a relatively small number of people, given the volumes of people, for example, we're talking about in terms of the return to the education sector. And as I've always said, there will always be many different considerations for government that NEFIT does not have to consider when we look at the public health issues in isolation. So in broad terms, very aligned.
I just want to return to the vaccination prioritisation changes that were agreed at Cabinet today. Taoiseach, you say that the government won't do anything that will put the return of children to school at risk, but there's been a fairly furious reaction from teachers' unions so far. Do you think that there might be any risk inherent in that? And then also I just wanted to ask a detailed question about construction. Is there a threshold for what is considered to be home building? I mean, is getting the bathroom done home building? Is getting an extension done home building? Is renovation home building? What is allowed and what isn't allowed within that rubric of home building?
Well, the departments will work with the various sectors, but we estimate about 14,000 workers are involved in terms of residential, and that's residential. It does affect one's residence and homes, and can be refurbishment and building and that. But it's a limited reopening, but an essential one in terms of the housing crisis that we face right now. In terms of the vaccination programme, again, I would have to state that when NIAC looked at this and the HSE looked at this, the operationalising of the various cohorts would prove to be very, very difficult and could delay the vaccination programme. And that's a key point here. And already you can see with cohort 4, there is no national disease register that would readily, have contact details for people with underlying conditions, and that has proved challenging for the HSE to deal with that cohort. Likewise, with many of the categories of workers in the 10 to 15, cohorts 10 to 15 are not readily identifiable, and it could actually have the implication of delaying the vaccination program. So under this model, older teachers who are perhaps more vulnerable, older Gardaí, a whole range of professions, will now get vaccinated more quickly, in our view. And it really is on the basis of the NIAC advice. They've looked at this, they've reviewed this, they're clear from their clinical perspective that this is a better way to do it from a health perspective, and in terms of the impact of the vaccination, in terms of outcomes on mortality, and in terms of severe illness, and that the evidence base isn't there to distinguish between one category worker versus another, and that's the advice.
Yeah, just in relation to the NIAC advice, I suppose the key premise or the underpinning objective of all of NIAC's work to date has been that we want to get vaccines to those who are most at risk of severe outcomes or death if they were to contract COVID-19. And again, that has been the basis upon which they've made their latest set of recommendations. So when they looked at the evidence for a whole range of different occupational groups, once you account for age and once you account for underlying conditions, and those are already taken account of in the way the prioritisation framework is set out. So once you take account for age and underlying health conditions, there's no evidence that any particular occupational group stands out as being at higher risk of severe outcomes from COVID-19. And given the fact that the key public health imperative at this point with the vaccination programme is speed, and to get this vaccination programme rolled out as quickly as possible so that we can continue with the progress that we're talking about here this evening. That combined with the fact that there isn't a strong evidence base for any one occupational group led NIAC to its recommendations, which is that we need to focus on age, starting with the oldest and those most at risk and working downwards, hopefully as quickly as possible over the coming short number of months.
Taoiseach, you mentioned that there would be businesses that would be significantly disappointed at today's announcement, and already we've had reaction from the hospitality sector, particularly pubs, who say that they haven't been given a clear roadmap to return. Now, you mentioned that there would be consideration given to the hospitality sector in June, but can you give an indication, is this going to be outdoor dining? I know Taoiseach in a speech said, hotels and B&Bs will be looked at in the month of June as well, so could you give a bit more clarity there? Also, to Taoiseach or Dr. Ronan Glynn, can we get an update on the 1 million doses of the vaccines that we were due to consider? I know Health Minister Stephen Donnelly had mentioned in the Dáil earlier this week that we should receive them in the next 5 days. Minister Ryan, just in relation to transport and travel, given that we will have significant amount of people vaccinated towards the latter half of the year, end of the year, do you see any travel abroad, we'll say for winter holidays? And just finally, a question on weddings. Do you see any increase in the number of guests that can attend weddings, and when? Thanks.
There's nothing I'd like to do more than give people, particularly business owners and workers, more clarity about when they can go back. I'm the Minister responsible for business, the Minister responsible for employment. I want businesses to go back as soon as possible. I want workers to go back to work as soon as possible. But it has to be safely. And it has to be in a way that we know will be sustained. And people say to me all the time, we want to go back as soon as possible, but we also want to know that when we're going back, we're going to be able to stay back. And that's why we can't offer that level of clarity now at this time. But I remember a few weeks ago when we produced the revised plan, the way forward, the plan for COVID, and we said we would focus in February and March on schools and childcare. That's been done. And we said at the end of March we would look at the 5K rule, construction and outdoor activity. That's what we're announcing now. So what we're saying, and it's only an indication and I can't promise it, but we're indicating now that for May we will look at the rest of construction, phase reopening of essential retail and personal services like barbers and hairdressers, religious services too, if and only if that goes well. And everything else goes well in terms of the vaccine programme and variants and the virus, then at the end of May for June we will look at those other things like the Taoiseach mentioned in and around tourism and hospitality, but can't give you certainty on that, unfortunately. What I can give certainty on is that the financial supports that are in place will remain in place at least until the end of June, and for sectors that have been left out or haven't got the support they deserve, there will be new schemes as well.
And just to say, look, that as vaccinations ramp up, opportunities arise. And so at the end, as the Taoiseach just said, at the end of April, we will consider the next phase. And we've outlined what areas we will consider, and we'll take stock then. In terms of the question in relation to vaccines, I believe you're probably referring to the AstraZeneca, BioNTech, Pfizer-BioNTech, and the Moderna have all significant doses coming in this week. No, I can get the figure for you from the task force, but it's quite significant. I think it'll be in around 230, but I'll check that. I'll check that figure. But it's good news. And the figures are hardening in terms of the supply of the vaccines, which is good news as well.
Just a little bit of clarity, just in relation to the 1 million doses that we're expected to see in the coming months.
Oh, sorry.
Well,
sorry. Look, the best reference there is the National Task Force will provide detailed data there in relation to that, in terms of the arrival, and there'll be different deliveries over the month, as is the case. But it's April. It's quite significant in terms of both what will come in and what will be administered. May, June and July. So they're the key months.
And just on the travel side, I think we have to be careful here. The numbers across Europe are continue to rise, so that there's nothing certain on this. But I think if we take the right sort of steps we're taking, I think we can avoid that. And I think the critical thing then is getting back to work, getting back to social life with family and friends, getting back to college or school or in a more normal way. We'll have to wait and see. I think it'll be later in the year before then we can look to see what's happening internationally, what is the prospects for international travel. First things first, let's get the Irish people back to work and back meeting friends.
Sorry, look, as I say, we'll approach this at the end of the next month, see what we can do then.
Taoiseach, can I ask you to go back again to the topic of vaccine sequencing? You've made clear that the reopening of schools fully on April the 12th is a key priority. And while there aren't predefined categories or databases for those who fall into other cohorts, one would think that education is fairly well defined. It's people who work for educational institutions, be they schools or colleges or preschool or wherever else. So in that light, would it not have made sense to perhaps keep teachers as a separate cohort? And can I also ask separately, because the Taoiseach mentioned in his opening remarks the idea that we might need now another PCR test upon arrival as well as one before departure. Can you elaborate on that, who it apply to and when it might kick in? And just on that note, if any of you could elaborate on the separate story today about mandatory hotel quarantine being extended to a significant number of new countries, please.
Yeah, well, first of all, this is NIAC advice. NIAC were asked to review this. And NIAC are very clear that age is from a clinical perspective, the better way to do it. It also will accelerate and simplify the rollout of the vaccination program and from an operational perspective. And it will mean that the older age cohorts in the different categories of work and in the different professions will actually get vaccinated now more quickly than they might have. But the advice is quite clear and it's quite strong in terms of the rationale behind this. And we're certainly not going to deviate from that clinical advice. And I think, again, overall, if you think the overall picture, the window is quite short here in terms of the rollout of the vaccination program now. I think as the over 70s will be fully vaccinated, as I said, by late May, they'll have their first dose administered by mid-April. So we're really making good progress in terms of the vaccination program, and I think it should be seen in that context. No, sorry.
Yeah, just on the PCR, that there's a government decision today to require a PCR test for people who've arrived in the country. As you know, before you arrive in the country, you already have to have evidence of a PCR test that's not detected or negative. It'll now be a requirement when you arrive as well, but that's about 1,000 people a day, so the exact logistics of that have to be worked out in the next couple of days, but it will be done.
Sorry, on the mandatory, the Minister for Health, the process is the acting CMO writes to the Minister for Health in terms of the legislative criteria, the criteria that's laid down in legislation in terms of additional countries, and the Minister consults with the Minister for Foreign Affairs in relation to that, so that you can anticipate that there will be additional countries added.
Taoiseach, prior to this evening's announcement, the government put a lot of emphasis on getting children back to training and in small pods. So why now has the GAA been prioritised ahead of children getting back to training? Was that down to lobbying from the GAA? Secondly, we now know that the championship will be up and running in May as well. We saw that there was a lot of outbreaks as a result of people celebrating after various finals last summer. What kind of plan do you have to counteract that this summer? And then can I ask Minister Ryan, you mentioned there that the hospitality and hotel industry will have a summer, but in order to have this summer they need bookings, and in order for bookings to happen, people need to know that they can cross county boundaries, and there's no indication from tonight's announcement around dates for that. So can you give further clarity on that?
Could I first of all say that last year the GAA was considered an elite sport in the context of level 5, and that's what facilitated the hosting of the All-Ireland Championships and Camogie Championships and ladies football. And they had fallen out of that for the first 3 months of this year. So in order to have a season, it's important that they would be able to commence league competition in May. The challenges last year were more focused on clubs, if we are honest, and the data would show that in terms of the club championships. There was a marked difference between the impact of the inter-county as opposed to the club championship. We're also facilitating elite athletes in different sports, not just the Gaelic Athletic Association, but in other sports, international elite artists who will be participating in international events, and that's important. And we're weighing this up. Like the rugby was important. The Six Nations, we didn't do as well as we might have liked, but there's some very good competitive games. And that's lift people as well. You know, there's a balance all along the way here. The national soccer team, we're all engaged, you know, and wishing it the very best as well. And they're going, you know, but it does. That's important. And I think we're trying to keep the balance right here. But I think it's important in terms of you know, the season out there, and to make sure that clubs can be facilitated later on in the year when we've almost everybody fully vaccinated, and as well. And hopefully we'll have all non-contact sports. We'll be looking at that at the end of April to see what we can do there for May, and we would love to have underage non-contact sport, but the numbers would be much larger. It would be in every single parish in the country. You'd be dealing with far greater numbers of people in far greater mobility, and on that basis, and you know, conscious of NEFIT's advice around where the disease is right now in terms of numbers, we took that advice broadly on board.
And just on that, you're absolutely right that the hospitality sector is going to depend on this, waiting for it. Worked in that sector, know exactly how they work. But I would expect by the end of next month we'll be able to give much more clarity on that. But I think it's right to, as Ronan Glynn said, we're still in a very precarious situation. It's right to get out of that and then give the step-by-step approach towards the end of next month, not just for the hospitality, but for other sectors too, I hope.
Okay.
Hi, Micheál Martin. An bhfuil tú muíneach go bhfuil an cuid is measa gon fandéim cora haran gur dul sa trócart támid agus an trócart bháin.
Táim muíneach go bhfuil míid ag dul sa trócart ach caihamíd bheith cormach ag an am géana. So sin éon fá go bhfuil míid ag dul le stocha brisínta maul le héad a bháin ach an tríana ag na vaccíní ag dul amach. Is léir go méid níos mó rohanna a going seachtain in na seachtainna agus go háras mí in na bhíosa. Agus so tá muíneach a sin agus is léir go méid a bhd níos mó vaccíní ar fáil sna mína atá le tacht ná mar a bhí ó hasach na bliana. So tá muíneach as agus ach i mí a brán agus bealtainna caihamíd bheith cormach.
Just setting aside the advice from the CMO, the advice from NIAC, how can you prepare for a teacher or a guard who are already being paid less than some of their older colleagues and being asked to do the same job throughout the pandemic, are now being told that they have to wait longer for the vaccine than some of their older colleagues, and even some of the cabinet who will now be vaccinated ahead of them? Do you think that's fair in the context of what all these people have done over the last year on the front lines, just on the fairness, rather than setting the science aside? And then on top of that, on hotel quarantining, will that last until the end of the pandemic, if there is such a thing? And will the current 3-month contract be extended until then, beyond that 3 months?
Well, first of all, we cannot set the science aside. We just can't base our decisions completely ignoring the science. And equally, I would say, it doesn't mean that they will have to wait longer. Actually, you know, it may very well mean that for some teachers it will be sooner. But I think the principle of our vaccination program so far has been those that are most at risk, those that are most vulnerable to the disease, that we vaccinate first. We get a better dividend from that from a health perspective. And that is very evident if you look at the serial testing of nursing homes, for example, of residents and staff. It's down, I think, at 0.13, I think, if I'm not mistaken, which is very, very low. The prevalence rate among frontline healthcare workers is very, very low now since the vaccination. So this will reduce the risk for those who you mentioned in terms of age much more significantly.
Vaccine bonus, which you've said will allow people gather in homes, go visit each other.
Yes, but I mean, it's very
Younger
much
teachers and guards who are already paid less than their colleagues are now going to have to wait longer for that vaccine bonus that you've promised.
Well, I think, look, when you take the overall period, where it's a relatively short period overall, I think the volume of vaccines is coming in very quickly. There would be a danger as well. No, you can't set aside the NIAC advice, but there would be a danger in terms of the complexity of all of the cohorts and working that out in terms of the efficiency of the rollout of the vaccine, which I can't understate either. And we've seen that already in the context of cohort 4, for example, which was in a cohort, but in terms of the identification of that was much more difficult. Again, there are many genuine and justifiable arguments can be made in respect of many professions, if we are honest, in respect of many professions. But we want to make sure that we can get vaccinations rolled out as quickly as we possibly can, so that we give greater protection to those who need it most, and also to wider society in general. Because the number of people, the greater percentage of the population we vaccinate, the greater overall protection we gain eventually. Oh, sorry. In terms of the quarantining and the hotel quarantining, again, we'll evaluate that as we move forward. The big concern there is, of course, as numbers come down, we do have to be very mindful of variants, but we'll keep that under review as we evolve and as we watch how the disease progresses and the impact of the vaccinations.
Taoiseach, are you concerned that what we've seen at the Beacon so far could be much more widespread and not just the isolated cases reported? And did that have an impact on the changing of the recommendation of how the rollout will be given because of issues of fairness? And finally, the Chief Executive of VHI stepped aside this evening pending an investigation. Did anyone from the Cabinet speak to him directly or anyone in VHI, and what was the nature of those communications?
Well, first of all, the advice was based on clinical advice from NIAC in respect of the cohort issue, and in respect of the wider issue, I again have to repeat what I said yesterday. These vaccines belong to the people. Those of us who are charged with the administration of these vaccines and those agencies have to make absolutely sure and certain that the vaccines are administered in accordance with the prioritisation that is laid down, in accordance with the rules and the protocols that are laid down, and any deviation from that is not acceptable. Because the behaviour in terms of what's happened in the Beacon has damaged and has angered the public, rightly so. And I think we've made this clear, and I think to be fair, the HSE are very, very conscious of this also. And in terms of the CEO of the VHI, I was at the Cabinet all day today, but I think my view on that again is similar in terms of everything has to be in accordance with the prioritisation as set down, and obviously there will be an investigation into that now. And I'd have to check with the Minister for Health. I was at various series of meetings today on that. Yeah.
At this point, are you concerned that the issues are more widespread at the Beacon?
Well, I have no evidence that they're more widespread in the Beacon right now, but I would be generally of the view, and very clearly of the view, that the rules have to be applied without fear or favour, and that is key to the integrity of the programme. Those who are most vulnerable should be vaccinated the first, in my view. The most vulnerable to disease and mortality, they must be vaccinated first, and it's unacceptable that there would be any deviation from that. And there's clear protocols laid down now in terms of any surplus vaccinations that may be, or vaccines that would be available at the end of the day.
Taoiseach, you said there would be no contact from the British government about obtaining surplus vaccine doses. Do you think you should now initiate that contact, or do you think it's now unnecessary in the light of the increased supply that you've been talking about? And just one more sporting question, if I can. Is this the end now of Dublin hosting Euro 2020 in June? Because UEFA gave a deadline of next week, April the 7th, for the host cities to guarantee spectators at these games. So is that the end of Ireland hosting Euro 2020?
Not necessarily, because I'm not so sure how many capitals will be able to have spectators, given the degree to which the virus is spreading across Europe. So there's continuing engagement with UEFA in relation to that issue, so we'll see how that evolves. What I had said was, in respect of the story on Sunday that emerged in relation to the potential of vaccines, there had been no official contact in that context, at all. I did say, of course, however, that I had spoken to the British Prime Minister Boris Johnson, I suppose about 6 weeks ago now, maybe shortly, in relation to vaccines more generally and other issues. And he was quite clear, that notwithstanding his great affection for Ireland and the degree to which he would prioritise Ireland, he had to get his own people vaccinated first, and they have some distance to go. So that's the actual position right now. Sorry? But I'm saying we had a discussion about it, so I've given you what it is. In other words, he headed off any questions in relation to it, because he was clear that, notwithstanding, as he said, his great affection for Ireland, he had to vaccinate his people first. And if, by the way, any surplus vaccines can become available, obviously we would welcome that. But I think, again, and remember, we're doing second doses a bit more quickly, or will, because of the different decisions we've taken in terms of the interval between the first and second doses. So there's a fair journey to go there as well. There are a number of weeks ahead of us, for honest, maybe 4 weeks ahead of us. Obviously, and we're looking all the time to see if the situation can improve in terms of our own supplies coming in from Europe as well.
Can I just ask, what's the best case scenario as you see it when it comes to vaccinations towards the end of June? What would be the maximum that you could see vaccinated at that point? And also, given the tightening of restrictions further around international travel, is there somewhere within that an acceptance that perhaps not enough was done about that in recent times?
No, first of all, I think where we're looking at, and again, the task force can give you greater detail on this, but we're still looking as a target for the end of June of 80% of the population, adult population, receiving its first dose. By the end of July, you're looking at potentially 70% fully vaccinated by the end of July, in line with the European target, and that would be our target as well. In terms of international travel, the impact of that, I think, will be better felt when the incidence is lower. Obviously, the B117 is the dominant variant right now. So obviously we've got to be very careful about other variants that may emerge. It's not simple, and we can see that. We're the first country in the European Union to introduce mandatory quarantining in the manner that we're doing in hotel quarantining. So I think that has to be borne in mind. There's a strong legal framework underpinning it. That's the context. Okay, we'll leave it at that. Thank you all very much indeed. We said we'll have it outdoors. It got chillier as the evening wore on, so maybe that brings its own discipline to the press conference.